right. Hello, everyone. Welcome to this topic today on talking all things period pain, gut health, and what are the best ways to mitigate those problems and improve your gut health. So today I've got on with me Karen Saunders, who is a naturopath and a good friend of mine. And we certainly work in very similar spaces. And I thought she would be the perfect person to come on and talk about hormones and how painkillers can cause some issues when taking long term, and what are the things that we can actually do to offset those issues, and what are some better alternatives. So thanks for coming on, Karen. Did you want to tell me a little bit about what you do as a naturopath?
Yeah, hey Jade. It's always such a pleasure to have these chats with you because I know we really bounce off each other. I'm a
Mm.
naturopath. I work in the women's health space primarily. So I help women with hormones and gut issues. Vaginal health is another interest of mine. So I've found over the years that you cannot fix hormones if you can't fix your gut. And so these
Mhm.
are my two passions. I have a practice in Melbourne. I see a lot of endo in my clinic, so it's something I'm super passionate about because there's so much that we can do to help these people with endo. So
And especially, with endo, obviously the number one symptom is pain.
yeah.
And so on that note, we tend to see, rightly so, a lot of people taking all sorts of different painkillers. So, what do you usually see when you're seeing so many people that have been taking these non-steroidals for anti-inflammatories, such as naproxen and ibuprofen, for a long time? What are some of the side effects that start to happen when you've been taking those for a while?
Yeah, that's a great question because often clients will come to me with gut issues or stomach issues, things like ulcers or gastritis, pain just under the rib cage. And then you dig a little deeper and you find out that they've been taking a lot of non-steroidal anti-inflammatories, ibuprofen and that. And often, well, because I see a lot of endo, it's because of that, monthly endo pain. So yeah, it's very damaging for the gut, I'm sure, as we all know. But how much is too much, and how can we mitigate that, are things that I help my clients with.
And I can certainly speak from experience, having endometriosis myself, and I used to take naprogesic all the time.
Um,
And that really speaks to the title of this whole interview today. Which pain do I want more, period or gut pain? And that was truly what would happen to me. Was I had to pick which pain I would prefer for that month, because I would get such bad gut pain from taking that naproxen
mm.
every month and taking so much of it. So, what about? We also talk about the liver a lot as naturopaths. Is there also a bit of a burden happening there too?
Yeah, specifically, well, we know that for a lot of endo sufferers or people with period pain, there is often that liver link. The
Mm.
hormonal metabolism is a little sluggish in the liver or perhaps the gut. And we also know that things like Panadol will really affect the liver. So, limiting the amount of Panadol you're taking. That's not to say don't take any painkillers or any ibuprofen or any Panadol, but it's just being aware of how much is safe, because Panadol does have that detrimental effect on the liver if it's overused, for sure.
Absolutely. And what are some of the signs and symptoms people are noting that they're experiencing when they've had that long-term damage or from overuse?
Do you mean from the liver or
Yeah,
gut?
yeah. So what would be some signs and symptoms that the liver detoxification pathways are struggling?
Yeah. I mean, it's so varied because the liver is so important in the body and has so many different functions. So it could be as broad as fatigue or headaches, or I mean, to the extreme, skin starts to yellow, but that's really more the extreme. I will often see things like brain fog or like a coating on the tongue, yellow or red in the iris, like your bowel motion, you could be a bit more constipated or sluggish, gassy, burping. You could have like
Mhm.
floating stools or pale colored stools. Really, I mean, rashes. It's so
Mm.
widespread when you have a liver issue because obviously this is like the detoxification pathway of the body. And if we're not clearing out the garbage, then, we're going to have a bit of a problem and it's going to affect the whole body.
The other thing as well, we know it's actually documented that people with endometriosis tend to have lower glutathione levels. And obviously, that is one of the biggest antioxidants that's depleted from overuse of paracetamol. And that can in turn impact other things such as fertility. Can you just quickly touch on maybe how glutathione is and why that's important for us?
Yes, absolutely. I love glutathione. It's our body or our liver's main antioxidant. So we use a lot of glutathione to turn toxic compounds into not so toxic compounds so that we can metabolize it and just release it out through the body, whether it's via the wee or the um, number twos. So we need good amounts of glutathione to help us metabolize toxins and hormones and any sort of pollutants like that. And so if we don't have good amounts of glutathione, we end up with, more of a toxic or sluggish picture in the liver.
Absolutely. And then, sadly, of course, with endometriosis, we know that when it comes to, say, fertility and conception, we run into challenges and not always. And it's so varied, of course. But one of the things that we want glutathione for as well is for supporting egg quality. And
Mm,
so it's like not only can endometriosis potentially impair whether it's obstructive, is it impacting the actual structures that help with fertility, or is it the inflammation and oxidation? But then on top of that, from all the overuse of medications that deplete glutathione, that's going to impact egg quality as well. So, it's
yeah.
amazing how there's just so many other things that come along with it.
It's such a double whammy, isn't it? Like, not only are you using all your glutathione because of the, paracetamol or painkillers, but you're actually, a lot of endo sufferers have low glutathione anyway because we know that we need a glutathione. At least that's one of the pathways by which estrogen is metabolized by. Um, so yeah, it
Mm.
really is that double whammy, and we need, as you said, lots of antioxidants and specifically glutathione for healthy egg quality.
Mm. So, on that note, of course, a lot of people will be thinking, well, I really depend on my painkillers. So, what can I actually do then? Because I don't want to be in pain. And again, this is something that I experienced for literally more than half of my life.
Mm,
And when you don't know what you don't. You don't know what you don't know, so you just feel like you're doing all you can. But that's where we come in as naturopaths because we have such a beautiful toolkit. So, what are some of the first line strategies you're doing with your patients to help to get them off that, help them to become non-reliant on those things and also help to repair that damage?
yeah. I think it's important to say as well, for a lot of people, they will still need a level of painkiller, whether it's non-steroidal or perhaps Panadol or something like that. But it's about mitigating or reducing the amount that they need. And some people, I've worked with that they've been able to come off painkillers altogether. So we have wonderful tools in naturopathy. We have wonderful pain herbs and pain nutrients. We have quite a wide toolkit to draw from, as well as looking at the person holistically. And often that's treating gut health and making sure that their gut is in balance, because that can really make the pain worse. So we'll use anything from, our herbal medicine, and, Hey Sisters, definitely one of those with the kaya, our turmerics, there's various other pain herbs in our toolkit that we use, as well as things like PEA. And then obviously we're going to look at the person holistically and think, okay, does their liver need that extra bit of support? Do they need
Mm.
more glutathione, for example, or do they need a bit of gut healing? And I guess this is where the Hey Sister kind of crosses both of those, ticks both of those boxes.
Mm.
Yeah, what are your thoughts?
Yeah, absolutely. Can echo that. And again, it is really, it's like every case is different, aren't they? Like, even with the amount of endo patients you and I both see, like every single case is different. But it definitely comes back to those foundations of, healing the gut, correcting those standard, even just dietary and lifestyle. And we can get into some dietary tips as well in a minute. But yeah, certainly with Hey Sister and Kaya Senegalensis, the beautiful thing about it is that, as opposed to your non-steroidals, which will switch down what we call the COX-1 and COX-2 pathway, which will switch off the pain, but will also, unfortunately, switch down your gastric secretions, that, is there to actually help with digestion and help to protect your mucosal lining. So over time, if we are switching those down, that's what can lead to ulceration. And so the difference with Kaya there is that it's more selective to the COX-2 pathway, and that is more about, down regulating that pain and inflammation at the source, but sparing the COX-1 pathway so that it's not impacting those important secretions so much. But on top of that, with the antioxidant status, because Kaya is so high in antioxidants, it's actually also squelching that free radical damage that can be causing that ulceration, and inflammation. So when people are getting off those NSAIDs and replacing it with an anti-inflammatory like Kaya, not only are you replacing it, but you're actually now going to help to repair some of that damage at the same time.
Mm-hmm.
And that you were talking about, obviously, gut health as well. And a lot of our really high antioxidant herbs like Kaya are known to be prebiotics. And actually, we use the word antioxidants lightly, but I guess we can more so term, we like to refer to polyphenols. So they're high in polyphenols, and that's what that antioxidant status is. So can you explain, because some people may not know the difference between, say, prebiotic and probiotic, and what is actually the benefits of those. So what is a prebiotic?
I love this question because I actually work more with prebiotics than
Mm.
probiotics.
Mm-hmm.
Probiotics are great and they are awesome to be used specifically, so specific strains for specific conditions. But it's also important to know that these are temporary visitors to the gut, and they don't, proliferate and are in there forever. They'll be in there for a few weeks or a few months, and this is beneficial because it allows your other bacteria to kind of flourish underneath that. But prebiotics are really just that step before, which is like food. Prebiotics are food for your beneficial bacteria, and so selective prebiotics or certain prebiotics will feed certain gut bacteria. So we learn to be very selective about what kinds of prebiotics according to what we want to grow, kind of like fertilizing your garden with specific things. So specific plants will grow. And I always talk about the gut like an old growth rainforest. So giving your gut the food that it needs, or the gut bacteria, will mean that you have your own natural bacteria that are already there, will grow and flourish if you feed it the right prebiotics. So that's something that I work with way more in my clinic than the probiotics. It has more longevity to it.
I agree, definitely. I really try and focus on that more and more these days. And of course, probiotics still have their place. And
Mm-hmm.
and even on that topic, you and I know this very well too, in how, for a long time, it was just kind of like take any old probiotic and people just assumed they're all the same thing. But, now we look at strain specificity and, what does that strain do exactly?
Yeah.
And I think now we're really looking at strains almost more like, um, a therapeutic agent in the way that we would use a nutrient or a herb, rather than something that's going to come in. And like you say, they don't actually colonize the gut. They just come in and do repairs and
Mm-hmm.
then pack up and leave. Like,
Yeah.
but absolutely, like you say, it's like, well, then how can we actually get our own, um, what's the word I'm looking for? Our own microbes to actually be able to flourish and thrive, because they're the ones that are going to be there and stick
Exactly.
around.
Exactly.
Yeah.
Yeah. Yeah. Exactly. And it's so true what you said. Like we used to just blanket the gut with different probiotics if we didn't understand much about, enough about the bacterial species in the gut. And so as we get more specific, we can more prescribe certain strains. But this is why actually prebiotics are just a bit easier as well. They're quite broad. It's
Mm.
fiber. Fiber in your food is prebiotics. It's not that glamorous, but I always say that fiber or prebiotics are like the OG superfood. That's all you
Mm.
need.
Yeah, absolutely. And that's the perfect segue into, dietary advice. And in
Mm.
fact, I even hate the term dietary advice. It's just like, how can we what are some foods that we can incorporate that may help with period pain and even endometriosis specifically, and perhaps some things that maybe we do need to reduce or cut out that may be adding fuel to the fire.
Yeah, that's a very good saying, because it's almost like it does just add fuel to the fire. That inflammatory fire. There's certain foods
Mm.
that will feed that and inflame your gut even more and make the whole environment worse. And then there's certain foods that have the opposite effect. And so we know things. I mean, I don't know if the research says this about gluten. Maybe you'll know a bit more about that. But in my clinical experience, I've seen, a reduction or an elimination of gluten to be very, very beneficial for, 99% of my endo sufferers. Really does reduce the amount of inflammation in the gut. I'm not sure the research has confirmed that, but I see that. So I'm going to stick by that one. Dairy, if you don't tolerate cow's dairy, that's another one that can be really inflammatory. Coffee, alcohol, and too much refined sugar are, probably the big five. Is that five? Yes. And so those are the big things that I would eliminate. Not too, and if you're a person who has a lot of IBS, irritable bowel, and a lot of bloating, you may need a trial of the FODMAP diet, which is a low fiber diet. But I don't recommend that diet for the long term. It's a diet that should be used for a few months while you heal the gut, and then you do reintroductions. So that can be useful, but it's only a short therapeutic diet. And then, the beneficials, I'm going to say it's like a double-edged sword. Fiber is one of the most beneficial things that you can have, or those prebiotics. And even if you are more FODMAPy, there's definitely certain fibers that you can choose that are low FODMAP. And this is because fiber will help to detoxify and release and start to metabolize your hormones a little bit better. So your hormones and toxins will get processed in the liver, and then it will pass through the bile into the gut, where you'll poo out all of your toxins. But you actually need fiber to bind to those toxins, and you need fiber to be able to go to the toilet every day. And so, fiber is one of those really important things, as well as what you were talking about earlier, like polyphenols. And like, what are polyphenols? They're a compound in a lot of plants, especially the brightly colored ones, that help to have a beneficial effect on your beneficial bacteria, and help them thrive and grow. And they also contain a lot of antioxidants, which help with inflammation. So, top five, I don't know. There's so many things with polyphenols, things like berries, pomegranates, like dark leafy greens, cacao. What are some of your top polyphenols? Green tea.
Oh, all of those, yeah,
Yeah,
nailed it. Like you say, and it's almost more about look at the color, like we
yeah.
say, like the dark pinks, purples, blues, and greens. Like the more darkly pigmented, the more highly concentrated those polyphenols are. That's what causes that color,
Mm,
in those plants. So, and that's where, like, I think you kind of touched on this before. Like there's no real like actual magic bullet that everyone's kind of looking for. It's like it's right in front of us. It's actually very simple, but yeah, actually, on the gluten thing, when I was writing my endo course, and I have a whole lesson all about gluten/wheat,
mhm,
and I went looking for the research around that, and there's not a huge amount of research, but there was one study, and I think it was maybe 2013 or something, so a
mm,
little bit old, but we're always lacking in funding for these areas in the research, so we just do with what we've got. And it definitely did show that people noticed a significant reduction in a lot of their symptoms. But that that's really just wheat in general. And so when I was comparing all the different therapeutic diets that we know of, so obviously there's, like you said, the low FODMAP, there's even low nickel diet, there's, biphasic, there's the AIP, and they all have the same things in common where they do remove grains. And then when we look at the fact that a lot of people with FODMAP issues, obviously one of the FODMAPs is fructans, and wheat is high in fructans. So for some people, they've gone on a gluten-free diet and they're calling it perhaps that it's the gluten that's the issue, but maybe it's actually the fructans that's the issue. So nevertheless, though, whatever you want to call it, whether it's a gluten-free diet or a wheat-free diet, most people do find significant reductions in their symptoms. And that really goes back to what do we see as clinicians, regardless on what the black and white information says. And if someone feels better on that, and I know it firsthand, like just how much my symptoms will either flare or reduce depending, like it's a direct correlation between my intake of wheat-based products. So,
exactly.
so
Well,
that there.
the thing, I mean, the proof is in the pudding, right? Like if you can just do a trial yourself for 4 weeks off gluten and see do you feel better, yes or no. If not, continue. And if you do, then that's something to reduce in your diet. I guess it's an easy test.
Yeah. And also I think that's why working with a naturopath is just so important, because we can help understand what component it is. And for example, if it is IBS, is it actually then SIBO, small intestinal bacterial overgrowth? And how can we fix that? And then if that's fixed, does that mean then you may actually be able to enjoy more high fiber foods that are good for your gut health? So it's like that flow on effect, right?
Yes, absolutely. Yeah. SIBO's a big one.
Yeah, absolutely. So, we're talking a lot about obviously the most important things, the prevention, the underlying root cause stuff. But naturally, again, endo particularly being a really painful condition, we also do need those strong painkillers, want it right now relief. So what are some of the top things that you use clinically that you find works, and how do they need to take it? Is it something they can take on the day, or is it best to take certain things leading up to the period that can help to really reduce that pain?
Yes. So we're talking natural, and we'll go natural and conventional, because I did want to say that if you are going to take ibuprofen, it's best to take it, if possible, just before the pain hits, and then take very, very moderate amounts. But looking after your gut as you do, if you have gut pain or stomach pain, I'm really talking about that pain just below the rib cage, specifically. That's where your stomach is, and if that's painful or spasmodic, that's showing that potentially there could be an ulcer or some gastritis, and any NSAIDs are going to be damaging that even more. So try and avoid. But if you are able to tolerate small amounts of NSAIDs, it's things like ibuprofen, then to start taking that before the pain hits, and making sure, I would say, that you're taking them after eating food, after you have eaten a meal. That can help to mitigate. But again, sometimes with these endo sufferers, that's not even going to touch the sides. So, things like trying other sorts of painkillers like our herbal medicines can be really, really beneficial, because we have various different types of herbs, and some of them act on that COX-2 pathway, like you said, and some of them are more antispasmodics, and some of them are more like act on that opioid or even in the cannabinoid system of the body. And so everybody's going to be a little bit different. When we take herbal medicines, like specifically for pain, I like to dose them nice and high when the pain hits. And then there's certain things, for example, you can speak to, hey, sister, and how you dose that. But I know when I use things like PEA, I use that light doses throughout the month, or even in the week before, in the lead up before the period. Then I go nice and hard, and slightly higher doses in the lead up for that few days before, and then during the pain. So it really does depend on what type of pain we think the client is experiencing. And we know with endo, there's often spasmodic, there's nerve pain, There's inflammation. So it's quite a wide range of types of pain that these people are experiencing. So having a broad toolkit to use from can actually help address the pain from various different angles.
Absolutely. And I think, PEA really speaks to that one. And for those listening who haven't heard of it before, it stands for a really long chemical word, and hence why we call it just PEA, but it's palmitoethanolamide. And interestingly, I now look at it, it's like a lot of us develop a PEA deficiency because it's an endogenous compound that we all produce ourselves. But the more we are in pain, the more we deplete our PEA, and then it sends this kind of feedback loop that says, well, we're not even going to bother producing PEA anymore. And so with the PA, you do need to give it time to build up. And so like you said, that's why we're kind of like giving that dose to keep on top of it. And then at the same time, it can be used acutely at the point in time of pain. But then also what you just spoke to is everyone's pain is different. And some people swear by PEA and they're like, this was a game changer. And on top of that, of course, we know there are different forms of the PEA. Dosages matter, consistency matters, duration matters. Some people say, I tried it and it didn't work and they didn't really take it properly or the right one or the right dose. But equally so, I just was speaking to someone today and she said she's been on it like 6 or 7 months and it just is not helping her. So like it just depends on the type. And, PA does have an affinity for nerve pain in particular, so it can be really helpful there. And this is where we're often layering different things. Like you said, we're seeking our toolkit, seeing what's going to be best for them. And so, for example, someone might take, Hey Sister, particularly, in that week leading up to the known peak pain, and then taking it during that pain as well. And so many people are like, wow, that this was like the best period I ever had. But then on top of that, we may need to be addressing certain more specific like nerve pain with a bit of PA as well. So like, and some people can get away with just needing one thing, like say chiasenic lenses, and other people do need like 5 things,
Exactly.
and it sucks. It really sucks. Endo is
Yeah, and
an
it's
S8
it,
for us. Yeah.
it's such a everybody has their own kind of different presentation and driving factors for endo as well, and that's there's not one cause, there's not one main cause of endo, and that's why we need to be very flexible and individualized with our treatment. And that's why maybe for some who are very, very gut based, who have a lot of gut dysbiosis, and like oxidative stress, then the Kaya or the Hey Sister would be amazing, even at those higher doses during that time when there is an endo pain flare, because the gut's going to be playing, quite a big part there. And then for some, it's that depleted PEA. So as you said, it's so individualized, and that's why I love rummaging around in the naturopathic toolkit and like bit of this and bit of that. It can be very, very
Yeah.
individualized and not just like layering in those painkillers more, because you can only do that to a certain point, and then you need to do something else.
Yeah, absolutely. And this is why you and I love our functional anti-inflammatories that aren't just about in that point in time and just some band-aid relief, like other actions that they're having. And again, we do come back to Kaya a lot in that sense because of the fact that it is an antioxidant and a prebiotic. And with Kaya, it's not just the period pain. Like people notice a significant reduction in PMS, and that is actually mentioned in the studies as well. And also because of that, the reduced prostaglandins, that also mitigates some of those bowel disruptions. Like we know that influx of prostaglandins, like with your period, can irritate the gut, and a lot of people get diarrhea before that period or with that period. And
is this where we talk about the period?
Yeah, that's right. Yeah, the period
The
poo.
real thing.
Yeah, and then a lot of people will be like constipated leading up, and then all of a sudden we'll just have this huge clear out.
Release, yeah.
Yeah, and again, please see your naturopath for that kind of thing, because we can help to fix that. There's a lot of issues going on there. But yeah, so any kind of functional anti-inflammatory that has multiple different effects can be really great there. And you did also mention as well, again, we touched on how it's more important to start taking these things before the pain hits. That's where you're going to get the most significant improvement. And it's the same with Hey Sister as well. It's highly recommended to take that in that week leading up to your period. And I guess, again, it depends on the individual. Some people only need to kind of start it a few days before their period. For those who have significant pain, I'd be saying start a week before if you can.
And
then
for those who have gut issues, would you use it consistently throughout the month?
So that's what I was just going to say, actually, is that there may be some people who could benefit from taking it daily, and then, kind of building up and again, doing that underlying repair from all the damage that's led up to that. And then you might find that you don't need to depend on it as much. But I take Hey Sister just like I would take any other anti-inflammatory. So like, for example, if I'm having gut pain from too much wheat, or like I've got joint pain and things like that, I might take even just one or two a day. And then I notice that inflammation significantly come down. So that really helps a lot. So one more thing I did want to touch on, and you actually started going into it before, we're talking about estrogen clearance, because estrogen is a huge player in a lot of these symptoms. So first of all, what are some signs and symptoms that you might have unopposed high estrogen? And even if you want to explain what that means.
Yes, absolutely. And it is important to note that just because you have endo, you may not have high estrogen. It's not always a high estrogen condition, but a lot
Yes.
of the time it is, and especially it could just even be at that the lesion level that there is that higher estrogen levels. But because I've seen lots of endo sufferers that don't have high estrogen, but so it's not a blanket call for everybody, but it's quite common that there's estrogen metabolism issues. This just means that estrogen is either there's too much estrogen coming in, and this could be something like xenoestrogens, for example, from endocrine disrupting hormones like plastics contain some of these things. So there could be too much coming in, and then so limiting the amount that you of endocrine disrupting hormones that you have coming in is a good thing. But also you potentially could be producing too much or converting too much. So from testosterone, you could be just converting too much into estrogen, so you have too much. Or potentially there's a metabolism issue, and that just means that you're not detoxifying it, adequately through either the liver or the gut. And this is what the unopposed estrogen that we talk about is. And some of the symptoms of unopposed estrogen or estrogen metabolism issues, whatever you want to call it, is things like painful periods, heavy periods, or they might be clotted. The blood may be more thicker or darker or clotted. Painful breast tenderness. PMS is a big one as well. PMS, could be mood, fluid retention, anxiety, depression, all these things. And as soon as I hear anything like that, I'm already going to be thinking, oh, we've got to test estrogen here. Those are the common ones that I see.
Absolutely. And I think that's such a good point that you made too at the start about, definitely don't think that everyone with do you even remember when back in the day when we were going through our studies, like a lot of people, there was this misconception that endo was caused by high estrogen, like that everyone would talk about it in that way.
Yeah.
And it's absolutely not. Like the estrogen issue comes after the endo. It's so multifactorial. It could be that you've got high estrogen that's totally unrelated but is making the endo worse, or the lesions themselves create their own estrogen.
Yes.
So that's like this vicious cycle. I think when we talk about estrogen issues, it's equally as important to talk about progesterone and why that's important. And so often it could be that you've actually got low progesterone, therefore you've got high unopposed estrogen, and it's going to exert more of those somewhat, unwanted side effects like you talked about.
Yeah, absolutely. Or it could just be, you could have a normal amount of progesterone, but relative to estrogen, it's too low. So you could just have such high estrogen that, your estrogen and progesterone have to be in a certain ratio. There is that. But what was I going to say? I've just forgotten what I was going to say.
That's okay. I can just keep talking and it will come back to you, I'm
What was
sure.
it? It was a good
But
one as well. Anyway.
it'll come back to you. I know it will. But that's also why, because so many people say to us,
David.
"Look,
Yeah.
I'm the pill," or like, what's the alternative to the like, and I'm talking about not for a contraceptive purpose, but and they've been put on it for endo. And a really good option for some people is the bioidentical progesterone. That's obviously has to be compounded, but that can be a really great option for some people who are really struggling with their endo and wanting to try something else. And some people get really good results from that.
Mm. Which reminds me of another thing that might be a good thing to chat about is Vitex and the use of Vitex in high
Mm,
estrogen
mm,
states. So this is another herb that if you're an endo sufferer or a pain sufferer, you'll often get prescribed, or it's in a lot of retail brands. It's
mhm,
a herb called chase tree or Vitex. It's a wonderful, wonderful herb. It does help to promote ovulation, and that it has a great affinity for the hypothalamus pituitary ovarian axis. So it's a great herb, not to demonize it at all, but it's not for everybody. And we now know that Vitex does increase progesterone, but it also can increase estrogen. So if you have a higher estrogen state, we don't want to be promoting that anymore. So perhaps Vitex isn't for you. And then something like another herbal medicine like Kaya could be a better option instead of the Vitex. There's always another option. But I think it's important to
mm.
talk about because Vitex is often just prescribed across board for any sort of PMS or sore boobs, or often in high estrogen state. So I'm not sure if you've come across that as well.
Oh, I'm so glad you brought that up actually, because I almost forget to talk about Vitex these days
Mm,
because of that issue. I never like you need like a whole hour to really unpack Vitex because exactly like you said, too many people. I think it's very much like the St. John's wort. Like, St. John's wort is so amazing, can work so well, but once again, because it's so effective but it's quite specific to, serotonin, and it can interrupt, and some people it's just not good for. So same with
mm,
Vitex it's so specific in the way that it can impact that HPO axis that it may not be right for people and could potentially make them worse. And I think it's even like even not to a lesser degree EPO or evening primrose oil.
mhm.
Remember when everyone would just get put
Yeah.
on that and they thought that was a silver bullet to all their repro issues.
Yeah, all the PMS, if
um,
only.
yeah, yeah. So again, I think Vitex really you need to be careful with it. But we like you said, we love it. It's beautiful, but for the right person and under
Absolutely.
the right direction and care.
Yeah, absolutely. Our herbs are powerful.
Yeah.
Yeah,
Mhm.
yeah, and so I really
Mhm.
like any sort of formula that's quite a simple, like a simple, basically. Sometimes
Mm.
formulas are great, but sometimes people have lots of sensitivities and things. So having these herbs in like just as one single herb that we can apply and dose accordingly is actually really really useful.
It's funny you say that because, again, when I was writing my endo course, I've invested months and months of research into every little
Mm,
thing, and especially our neurodivergent brains, we have to like know the
yeah.
minutiae of everything. And when it comes to I've just had a mind blank. Oh my god, like what were we saying again?
uh,
Wow, I
oh,
can't that just
simple.
completely
No, we're talking about
simple herbs, yeah, that's
yeah,
right.
yeah.
Completely like went out of my mind, just like,
Yeah.
vroom, like, yeah, so the more that because of course, when I was, like, researching about all the different herbs and what they do, and I also within my course, I don't just tell people, what the herb or supplement is, I actually recommend the exact product that I think is best so that they're not left guessing,
Mm,
and the more that I kept researching, the more that I actually came back to more simplistic ways of prescribing.
mhm,
And I think it's even like with SIBO, for a long time we always used to go for these multi antimicrobial herb mixes and want to add in as many antis as possible. But now it's like really coming back to that real simplistic way, and it's just as effective.
mhm,
And because the more simplistic that prescription is, so say it's just one herb like kaya, you can also mitigate if someone is, say, having a reaction to something. The less things you're on, the easier it is to figure out what is it that you are having a side effect to. Whereas if you've got a formula that has 10 different herbs in it, how do you know which is the problem? And it may not even be that product, but it's really hard to figure out which one it is. So,
Yeah, it's
um,
really tempting as a naturopath, especially in the first
yeah.
few years of practice, to blanket, oh, I've got to cover that base and that base and that base with this herb and that supplement. But then I guess as I've, gone on in my clinic, it's more important to go, okay, let's do one or two things and assess and see what really works. And then if it's working, go, high, what's the optimal dose? Rather than just, try and, I guess, hit every single target, which, may or may not. It's also expensive. So
Yeah. Oh, absolutely. And I really do think that this actually it comes down to the experience of the clinician. Like you're just saying, in your first few years, and like it's not to say that it's wrong, it's just that like we're still learning what's absolutely most effective, and we haven't yet had enough time to see the patterns and trends and things like that. And then after time, like you go from prescribing, quite a few things to actually really simplifying it and like going with the absolute most effective and actually saving people money. And that's why like I really, really do love Hey Sister. Like I could talk about it in my sleep because it's just one thing and it's very effective, and it's even been shown to be effective for menopause. Has a really high safety window. So like I personally haven't heard of anyone having any issues with it, but yeah, anything that has that high safety window is obviously really good too.
yeah. Do you know much about the research in menopause?
I haven't looked at the actual studies,
Yeah.
but they actually have created so they've got Hey Sister, and then they've got one called Menopause, and
Oh,
it's yeah, and so it is just called Kaya Senegalese. Sorry, it's just the same product but just called something different. But there are multiple people that report that it significantly improves their menopause symptoms.
amazing.
And I think, even like obviously, with the like hot flushes and things like that, obviously menopause is not my domain.
I'm
But
currently upskilling a lot. I have a lot of,
oh, nice.
perimenopausal clients. Yeah. Yeah.
Yeah, that's good. Like, I feel like I'm very much one of those people that stays in the lane of things that I've experienced firsthand, and I've always tried to avoid menopause. Of course, I've had
Me too. Wait
menopausal
till you get to 40, Jade, then you might change your
Yeah, I know.
mind.
And, like, that's exactly what I've been thinking. I was like, "Jane, you're gonna actually have to force yourself to dive into this soon because, perimenopause can come up."
Come
Like,
see me because
mid to late
I'll be much older than you. That's how you can come see me.
Yeah. I'll come to see you, absolutely. But yeah, so many people finding,
Mm.
really amazing benefits. I honestly think that they should create one even, that's, targeted towards that's more, I guess, masculine in branding because it can be used by men, women, anyone assigned female or male at birth.
Mhm.
It's absolutely can be used by anyone
Mhm.
that experiences pain and inflammation because of the
Yeah.
way that it works. So,
Yeah,
yeah.
and because of that broad range, which is like the prebiotic and antioxidant,
Mm,
um,
mhm.
which, as you said, is some of the major, well, let's say, all diseases got an inflammatory base to it, doesn't it? So it's super useful.
Yeah, absolutely. Well, I reckon that was a pretty amazing conversation. I think a lot of people are gonna learn so much from this. I really appreciate you coming on, Kaz. I love you. You're amazing.
So,
And if there was any way that, people could find you, where can they locate you?
just my Instagram, which is Karen Saunders Naturopathy, or my website is karen-saunders.com. Happy for anybody to DM any questions. And yeah, just get hold of me on my website or DM me.
Beautiful. I have no doubt that people will wanna see you after this and you sharing all of your knowledge. You are definitely a world of knowledge and, in speaking to you regularly, the amount of upskilling and extra education you're always doing, I know that your brain is yes, it's loaded with information.
Looking forward
Yeah.
to a holiday.
Yeah, absolutely, yeah. Well,
Oh,
thank
it's
you so
wonderful.
much for coming on.
It's really fun, Jade. Thank you.